All new tonight, renewed concerns over nursing homes as new data shows a recent rise in COVID cases and deaths in these settings. Some are blaming low vaccination rates among staff. Our Brianna Harper is taking a look at what the numbers show and what they mean for those working and living in these homes.
Data shows COVID numbers are up for the general public, mostly due to the spread of the Delta variant. That strand of the virus then gets brought into nursing homes by the staff, quickly increasing COVID cases and deaths within.
Nursing homes are paid to provide them care, and we feel that it's very important that those people be able to be protected basically in their homes.
And that starts with vaccinations. Last month, President Joe Biden announced all nursing home staff must be vaccinated in order for the facility to continue receiving federal Medicaid and Medicare funding. At the time, some nursing homes like Sharon Towers in South Charlotte were in full support.
Closing this gap to 100% will provide our residents safety and peace of mind for sure.
But that's not the case everywhere. In South Carolina, only 9% of nursing home facilities have reached the standard of having at least 3/4 of their staff vaccinated.
We kind of expect to see a spike for a while as vaccination rates still remain low. And then we're hopeful about the requirement to get vaccinations for staff will lower those numbers.
But for now, a nationwide report from mid-July to mid-August shows a 6-fold increase of residents with COVID, 8-fold increase for staff cases, and 9-fold increase for COVID deaths in nursing homes. But the good news is we've overcome much worse.
Those numbers were way down from where they were a year ago. So we are seeing much better numbers. For instance, the total death rate is still just under 1 per 100 residents in nursing homes, whereas at the height, it was 4 or 5 per 100.
But the impact of COVID-19 is still playing a part in nursing home staffing shortages and high turnover rates. If you take a look at these graphs from the American Healthcare Association, you'll see survey results from employees being asked to work overtime and the difficulty in hiring new staff. Brianna Harper, WCNC, Charlotte.